COVID-19 is very worrisome for patients with cancer, and as it's impacting the respiratory part, especially concerning for patients with lung cancer. So today I'm very, very pleased to welcome Dr. Jasmine Fox to really discuss with us how lung cancer patients can stay safe and still navigate well through this pandemic. Dr. Jasmine Fox is the medical director of the Royal Castle Lung Cancer Foundation, and she's also the secretary for the Global Lung Cancer Coalition. So, Jasmine, thanks so much for joining this series. As I said, I assume lung cancer patients are really worried. So I just would be curious, what questions do you receive? What concerns do patients have? And do you have any advice how they should navigate these days?
Yes, so COVID-19 has been particularly difficult for lung cancer patients. Most of our patients are actually in that very vulnerable group that are having to self-isolate, for example, at home during the COVID-19 crisis. We're also seeing that there are multiple other things that are happening to our patients. Because of the nature of COVID-19, a lot of our lung cancer experts are being redeployed actually from lung cancer service. So we're actually seeing a number of lung cancer services suspended at this point, both diagnostics and treatment services. So that's really difficult for patients. And I think our big message to patients is that everyone has to talk to their clinical team because clearly patients are very concerned to leave their homes. They're scared, they're afraid of contracting COVID-19, of going to hospital for their treatment and actually contracting it. So there is this balance between what is required for my individual treatment and what are the risks of me leaving home and going to hospital. So again, I would say our advice to all patients with lung cancer is that they really must talk to their clinical team, especially if they've just been newly diagnosed or if they're actually undergoing active treatment at this time.
And how do you recommend that they should connect? Should they call or should they go to the hospital? Probably that's not advisable. Any thoughts there?
Yeah, so absolutely, definitely calling, definitely don't go to the hospital unless you've agreed and that your clinical team are happy with it. That's the only reason you should go to hospital at this point. We're finding, certainly here in the United Kingdom, that the vast majority of consultations during this period are being done by telephone or by teleconference. And it's been really interesting, that may be one of the lasting things that actually comes out of this COVID-19 crisis, is that more patients will be getting seen remotely so they don't have to go up to hospital quite as often as they perhaps did before. We'll just have to wait and see. But definitely advice is definitely get in touch by phone or by video with your clinical team and then make decisions based on what's happening there. It's a really, really difficult time, and we know that patients are not getting the kind of treatment that they would have been advised to get previously. And that's really, really difficult. But it is this balance at this point in time about the benefits of getting your treatment and the downside of risking getting COVID-19.
So Jasmine, I mean, the foundation is doing great work, but has COVID-19 impacted the operations? How easy is it to navigate and do really your work in these days?
This has been a really difficult time for charitable, not-for-profit organisations, and patient advocacy groups are really finding this difficult. Our fundraising base has kind of dried up, it's disappeared, because certainly for my charity, most of our funding comes from mass participation events like marathons and things like that. So obviously that's not happening. So there is a degree for all of us about just getting over this acute phase from a funding perspective, and we're all concerned about the future. It's been very interesting in terms of our support and information services. We're obviously not doing face-to-face patient support groups at this point, but our online services and our telephone nurse helpline have been extremely busy. We certainly, a number of other organisations have seen that too, so that because patients are at home, there are different things happening to their treatment that they were perhaps expecting. It's harder to get in touch with their clinicians sometimes. So organisations like mine are kind of filling that gap a bit. And so it's really desperately important that I guess the message out there is that if you do have support services available to you in your country, wherever you are, then please do use them at this point. That our service is still here. A number of other organisations are doing the same. We do, however, appreciate that a number of organisations have just had to shut down. They haven't had the funds to be able to get them through this period. So that, it is challenging for us as organisations as well.
Yeah, but I still see you do amazing work, and I think it's so important for patients that they have, an organization where they can go to. Let me just ask, even in this difficult situation, what gives you hope? When you look, and in your interactions, when you see what's going on, what gives you hope?
Yeah, so I think very much the hope is that we're going to come out of this. We will get over COVID-19. How long that's going to take, I don't know. Nobody knows. But we will get through this. And it is about getting through this, because we've seen over the last months and years so many improvements in lung cancer, and we're just kind of on the cusp of getting lung cancer screening implemented across many countries. And sadly, that's all been suspended because of COVID-19. In the United Kingdom, there are no cancer screening services going on at the moment, and I think that's the same pretty much across the globe. So in terms of lung cancer screening, there's huge hope in that when we all start to open up and get back to normal. And there's hope also in the new technologies, the target therapies, the immuno-oncology. So for lung cancer, there are a lot of really good things kind of in the pipeline, and they're still there. It's just at the moment we can't implement things because this virus has stopped so much and suspended so much. So I think for me the hope is that we get through this and we start to make things better, and we genuinely see improvements in outcomes for lung cancer patients. But I think it is going to be challenging in the short term. A lot of patients, as I said, have not been getting their treatment. We know that across the world, the referrals for investigation for cancer are way down. At some point in the future, all those patients are going to have to go through investigation. So there are huge challenges. But like I say, ultimately, there'll be lots of good things happening for lung cancer.
No, and thank you so much, and really for the passion and the great work you do. I mean, what I took away from this discussion is really that you really advise all patients that they reach out to their clinical teams, do it on the phone, and really get and insist on their treatment. It's very important. And as you know, we all together work on improving the outcome of lung cancer, and there is big hope. But we also really need to encourage patients. They should ask for treatment. They should engage with the clinical team. So Jasmine, really enjoyed your input, and keep on the great work, and really good luck to the foundation. And thank you so much for being here with us today.
Thank you for the opportunity. Thank you.